A lot of you requested me to make a video explaining about the different options that are existing for breast augmentation. Well, as you all know, the main option that still exists and is the number one option for breast augmentation is use of a silicone implant. But then fat is also catching up. Fat from our own body can be harvested from certain areas. It is purified, filtered, and then it is injected into the breast to give enhancement in size of the breast. So in this video I am first going to explain to you the first option for breast enhancement in the form of fat grafting. Fat grafting is a minimally invasive procedure for increasing the size of the breast. Fat can be harvested using liposuction technology either from the tummy or from the sides or from any other area where you have excess fat. Now fat that is aspirated through liposuction has a lot of impurities in the form of blood, in the form of fibrous tissue. So fat is not directly re-injected. It is first collected in a canister. This fat gets filtered, then it's washed with saline, and then it's mixed with antibiotic, and finally what we obtain is called as a purified fat graft. And this purified fat graft can then be inserted in specific areas of the breast to enhance the size of the breast. So fat is a very good option if you are someone who needs like up to a 1 cup size increase in size of the breast. Fat is not for those who want too big a drastic change in the size of the breast, because that's not how fat works. We cannot inject unlimited quantities of fat for breast enhancement. So if you are someone who's looking at certain areas like post-pregnancy, there sometimes may be sagging in the breast or loss of volume in the upper pole. So those are good patients for fat grafting. But if you are someone who's looking at too much of a drastic increase in size of the breast, then fat is not for you. The advantage of fat grafting to the breast is that this is a minimally invasive procedure and the fat is removed through very tiny incisions and it is injected also through a very tiny puncture. So there are no marks on the body, there are no incisions that need to heal. Of course, after the fat grafting is done, we advise you to maintain your body weight. We don't want you to lose a lot of weight, because if you lose too much of weight, then even the fat can shrink in size. So as a corollary, what it means is, if you want to lose more weight, do the weight loss first and then go for fat grafting. After doing the fat grafting, try to maintain more or less a constant body weight. Fat grafting to the breast is normally like a daycare procedure where you can come in the morning and go home in the evening. And after surgery, there may be some aftercare in the form of antibiotics and painkillers and application of some gels to speed up the process of recovery. In terms of the final outcome, it takes around a month and a half for you to see the final result, and whatever fat has survived by the end of the third month is usually what is going to last. We normally expect 20% of fat cells to resorb over a period of this time, and therefore if you need 100% of fat cells, we normally inject a little bit more, like 120% of fat in both the breasts. So this is how fat grafting to the breast works. The other important modality for enhancement in size of the breast is of course the breast implant. Now when breast implants came into vogue, the type or make of the implant that was available and the implants which are used now are totally different things. The current generation of implants is like this. So it's a very soft material which is called as a cohesive gel implant. Now these cohesive gel implants are available in two forms. Either you can have a round implant or you can have a teardrop implant which has a bit of shape. These implants come in different profiles so that there is different projections that we can offer. And the best part about these implants are that they are now permanent implants. So once done, they are for the rest of your life. Now breast implant surgery is again a daycare surgery. And the incision that is used for inserting the breast implant is an inframammary incision which is concealed in the crease under the breast. It is hardly 3 cm long, and the stitches that are used during the surgery are all dissolving stitches, and usually when the patients come back for a follow-up a month or 2 months down the line, most of the marks are already gone. The aftercare involves wearing a sports bra for at least a month till your stitches are healing. And in terms of the recovery, you should avoid any kind of jogging or any kind of intense exercises at least for 15 days to 1 month. Once the suture line has healed and once your implants have been accepted by your body, they feel very natural. and nobody can make out that you had a surgery. A breast implant is a good option to get a better cleavage. It is a good option to get a lift to the breast, because implants have their own viscosity or thickness, and that's why if someone has a little bit of sagging in the breast, implants give a much better outcome than other modalities such as fat. So fat and breast implant both are very good modalities. Whether you are a good candidate for a fat grafting or whether you are a good candidate for a breast implant, that your plastic surgeon can guide you after examining your body type.